Ortho-biologics is a field of medicine that harnesses the power of your natural biology to heal something that's been damaged over time. When you can use a cell and encourage it or induce it to become something else, it can actually take the place of what's been degenerated. So platelet-rich plasma are the platelets in the blood, and those can be put into any part of the body to induce stem cells that already live there. So what I do is have patients come in. I'm a sports doc. I get people exercising. So people come in for 20 minutes of fairly vigorous exercise. That gets their heart pumping, gets their blood pumping, gets their veins nice and big so it's easier to draw the blood, and it increases their platelet count.
Then they'd pull the blood, then they'd put in a centrifuge and spin it.
We use a double spin method to increase the concentration. So we take about 18 cc's of blood, and that creates 6 cc's of PRP. When they're done processing, they get in position and I inject those platelets, the PRP, back into that joint.
It's sweet. Obviously, surgery is usually a last case option. You really don't want to go to that, so I'm really glad we can do this, and hopefully I'll just be in the boot for four weeks and then I'm ready to go afterwards, so it's a pretty easy process.
In that person that doesn't have as many cells, you could actually harvest cells from somewhere else in the body. And there's a lot of places you can get them, but the two most common places is adipose, which is the science name for fat under your skin. The second place is bone marrow. Now, the stem cell procedure is a bit more involved. I numb the skin and I numb the adipose, the fat layer under the skin, and then I let that sit for a while and let the cells kind of percolate and let the fluid surround them to open them up, and then I remove those cells. They go through a process of screens where they get cut smaller and smaller and smaller so they can fill in the gaps in the cartilage. Drying the bone marrow is we do in a sterile technique. We turn our exam room into an operating room, and we're gowned and gloved. We clean the area, make a small incision, and then the needle goes into the bone marrow to withdraw the bone marrow aspirate. Then after that, the patient comes back into the room. We inject it one at a time, a little bit of the adipose, a little bit of the bone marrow, and a little bit of the platelets. And it's going to feel pretty full because of that. And the way that the cells work is they increase inflammation. So I always tell patients, it always hurts a little worse. It gets worse before it gets better. If you hang in there and try to breathe through it, muscle through it, it'll be better on the other end.